I especially thank you for joining this webinar because I'm absolutely sure it's probably your 1000th webinar in the past 18 months. I can assure you it will be worth it, and I'm sure that's why you're all here and you're all signed up, ready to go. I'm delighted to have worked with such an incredible team of panelists to bring you an informative discussion around a relatively broad area, as you can see with the question. But we will be attempting to answer as many questions as possible, particularly in the areas around how innovation drives health equity, how innovation doesn't need to break the bank, and future trends in the healthcare industry. So I hope we can address any questions that you may have, so please feel free to include them in the Q&A in the Zoom, and myself and my colleague Patricia will moderate those, and we'll really try and save some time at the end. So I'll stop talking and I'll hand over to our exceptional moderator, Priya Bathija, and I will see you at the end. So thank you once again, everyone.
Thank you, Felicity, and good morning or afternoon to everyone who's joined us, depending on where you are. Thank you for joining us today for this conversation on how do you make innovation work in healthcare. I'm Priya Bathija, Vice President of Strategic Initiatives at the American Hospital Association, and I'll be your moderator for today's conversation. Today, I am excited to have this conversation around innovation. Healthcare, as we all know, is changing at a pace we've never seen before. So doing our best and working harder isn't going to be enough as we move forward. Instead, we need pioneers to not only navigate, but drive innovation and to improve the value of care we offer to patients and communities. And this includes innovations that lowers cost, improves access and outcomes, and enhances patient experiences. So over the next hour, I will be talking to those pioneers that are leading Common Spirit, Olive, and Burst IQ, and they will share how they are driving innovation. As Felicity mentioned, at any time during today's conversation, you can enter your question in either the chat box or the Q&A box, and we will get to as many of them as we can. So we have a lot to learn from these leaders, so let's get started. To kick things off, I would like to introduce our speakers and ask them to turn on their cameras if they haven't already. I am joined by Sean Lane, who is the CEO of Olive, Frank Ricotta, CEO of Burst IQ, and Rich Roth, who is the Chief Innovation Officer at Common Spirit. Welcome, Sean, Frank, and Rich. It's so great to be with all of you today. Let's get started with some level setting. Can you share a little bit about how each of your organizations, and then how you're defining innovation in the work that you do? And Rich, maybe we can start with you and then go to Sean and Frank.
Well, great. So nice to be here this morning and to have this conversation, and really appreciate the chance to share a little bit about our story. So Common Spirit Health, we are the largest not-for-profit healthcare system in the United States. We service 21 states, and our recent combination between two organizations, Dignity Health and Catholic Health Initiatives, that formed roughly 2 years ago. We're many different things in many different communities, from hospitals to health plans, physicians, ambulatory care centers, and others, and really joined by a common mission to care for the health of our communities, particularly the vulnerable and the underserved. More than 70% of those that we serve are in the Medicare or Medicaid program. And so health equity is something that is very deeply important to us as members of the community and trying to live out our mission. So, I think innovation means so many different things to so many different people. I think sometimes it's a trap defining the word innovation because it excludes people in some ways if you're not necessarily, within that innovation. We coined the term strategic innovation in a way that really looks at, what is healthcare going to be like in the next 3 to 5 years? And then how do we pull forward those competencies, capabilities, services, technologies today really learn how to implement them, to make refinements, to port and scale them, and to really think about the muscle memories that are necessary to transform healthcare. It's a very complex industry, I think, as we all know, with many different experts in various different levels. But I think, a constant R&D mindset to porting and testing and creating change is really what's at the heart of innovation for our organization.
Thanks, Rich. And I'm glad you mentioned health equity. We will touch on how we can use innovation to improve health equity later in our conversation. Frank, I'll turn it over to you.
Sure. Well, hello, everybody, and thanks, Priya. It's definitely a pleasure to be here. So Burst IQ. Well, we're going to attack this from a little different perspective, as from Burst IQ in terms of our view of life, because we're kind of an emergent company. We're still relatively small. So, our whole purpose in life was to really step out and try to address this whole space of health, access, and equity. And we like to say we do that one LifeGraph at a time. And LifeGraph's our core product. And, everybody has a social media account. And, what we've done is we've started, our whole product takes data about you and turns it into smart data and creates these longitudinal profiles. And we're a B2B service offering, so we help our customers use LifeGraph to engage with all the people and places and things that drive their business. From an innovation perspective, when you're a small company, you really have to attack innovation from a couple different angles. One inside the company, because you may start out with an approach to address a market. But you have to be very cautious that it just doesn't become so rigid that you lose sight of potential opportunities. Got to hang on to your why, but the how can change in the early stages as you kind of go from early adopters to kind of market adoption. Second is when you work with customers, and you have to find customers that really have kind of this creative mindset early on in terms of looking at how they could potentially change how they're doing things, but more importantly is once they start engaging with you, seeing how things can be in a totally different light. A friend of mine, John Cahill, writes a lot about innovation, and I love his analogy of old nautical charts. When technology or a market disrupts a certain environment, when the disruption is over, you're still in the known world and you can navigate back to a new path. But discontinuity is often the product of innovation. And discontinuity means you're at the edge of the map. We're only monsters and you fall off the world. So you have to really get reacclimated. And I think innovation takes on both sides of life.
Yeah, thanks. And I really like that analogy. Sean, can you turn it to you?
Sure. Hey, hi everyone. Nice to meet you. Thanks for joining today. For us, I think innovation is really comes down to these very simple ideas, like all the way back down to the most basic principles. And it's not the complexity that leads to innovation. It's really the simple ideas. And for us, we think that healthcare doesn't have the internet. Nothing's connected together. And we experience that because every time we go to a health system, we have to reintroduce ourselves and, fill out a clipboard and, healthcare doesn't know who people are. And I think that's a really basic fundamental issue. And I think that's where innovation really starts with identifying these very simple things. Healthcare doesn't have the internet. Healthcare doesn't know who people are. And I think that's, if we can kind of look at it from that perspective and how do we connect everything together? How do we, give healthcare a memory so that they remember you and who you are and what you've done and where you've been? I think we can make a lot of progress. We're doing that through automation in general, like a very basic concept of, wherever there's human intervention where there shouldn't be, we're trying to remove the human intervention. We're trying to make things automatic. We're automating in its most basic form. Things that should flow, things that should be connected, things that should happen without manual processes. By doing that, we see a ton of data, which allows us to get smarter and do things, do even more automation. So it's a nice little flywheel effect. But I think we get caught in these like really complex stories of like of very specific industry accepted patterns that we just have to break out of and say, like, let's do the basic stuff. Let's connect stuff together. Let's remember who people are. Let's take out manual processes that don't need to be there. And if we do that, we could affect like $1 trillion of cost and, help, tens or hundreds of millions of people. So that's how we approach it. And I think that, the other thing to end or just to say about innovation is that we shouldn't continue the narrative that healthcare is a laggard, and we should start the narrative that we are actually ahead of a lot of industries. And it's actually true. Like I came into healthcare and people were like, oh, it's 10 years behind, decade behind. Some things, sure, but not everything. And in fact, that's changing. Like people are going to take our technologies from healthcare and adopt them in their industries. We're going to be the leader in the future, just like the defense industry was the leader back in their day. We are going to be the new leader of these technologies. So that's how we think about it.
Sean, I think that's a really important point. And I think sometimes in healthcare, we're quick to say we're the dinosaur, we're not moving fast enough. But if you think about the actual treatments, the technologies that we use to treat patients, we're light years ahead of everyone else. And so if we can figure out the automation and the business aspects of being customer focused and improving value in that way, we could be ahead of the game in a lot of areas when it comes to other industries.
I think absolutely. When you have the acuity of a life or death situation, and you have hundreds of millions of the sickest people in the world rushing through your doors every day while you're applying technology, that's going to lead to these really incredible advances. And I think just like we saw in the battlefields and we saw in the race to outer space, like all those things lead to these incredible advances. And we're on the cusp of some really incredible advances in just like automation and productivity and enterprise architectures that are going to come out of healthcare.
Yeah, that's awesome. So shifting a little bit, and Frank, you touched on this when you were talking about innovation, but needing to start with innovation within your organization. And to really do that, you need to have the right culture, right? You need to have the right mindset that's looking at problems in different ways and coming up with new types of solutions. Can you give us your thoughts on how you can create that culture of innovation within your organization and how to do it without breaking the bank?
Yeah, it's a great question. I think Rich mentioned this earlier, you have to have this whole mindset of it's okay to experiment and to try new things and to look at new things. And the other aspect is, you can't be shy about looking at what's happening around you, both from, what the market leaders are doing from the standpoint of providing solutions and what best practices are, but what incumbents are actually bringing into the market and kind of that early stage of innovation. And then really, really having open dialogues of how that impacts you. It's really this notion that if you don't obsolete yourself, somebody else is going to obsolete you in some shape or form. So it's battling the rigidity of this is how we've always done things and this is how we're going to continue to move things forward. So kind of busting things out of that box and really, really being a good catalyst in doing that.
Yeah, absolutely. And Rich, from your perspective, how do you do that at an organization as big as Common Spirit that's spread across the country?
Yeah, we have an approach we designed really early called Run, Run, Jump. And it was actually modified after like learning how my kids did their swim classes where, they put these flip boards in the water and you would kind of run on the flip board and jump into the pool because you were scared to get in the water, but you were still running like you were running on you were running on land. And so, what we really do is we take, an early adopter component of our system and we bring in, either something we created through, IP, through the minds of our physicians or nurses or security guards or lab techs in terms of a new idea or a new service, or, an emerging partner like, Sean's company or Frank's company. And we really test them out in that initial site, which we call a run, right? And we hold that, and we hold the outcomes, very consistent with things that we would want to see in order to scale and to grow that in a variety of different areas. And so I think that's really important. There's a lot of pilots in healthcare, and I think one of the reasons for that is, people create kind of free passes. Well, you don't have to go through security, to do this pilot, or, well, we won't put you through the same legal scrutiny to do this pilot, or, well, you don't need the same operation stakeholders. And we're very clear, even when you do one of our first runs, you go through our enterprise security requirements. You're going to be measured against what a eventual buyer of your service or idea would pay for those types of services. So we do a first run, and if it's successful, we do a second run where we mix something fundamentally up. So maybe it's an urban hospital to a rural. Maybe it's an area where it's fee for service to fee for value. Maybe it's an area where, it's employed physicians to independent physicians. We want to really try to isolate if there's a real issue that prevents scale. And then after we've done a second run, we have much more confidence in our jump mechanism, which is our scaling mechanism. So, basically, I would say, it's really important to do things in real world environments with real stakeholders and not to create artificial environments. When you create artificial environments, I just think you're not testing something that can really work in reality. And that's really the process that we go through with our innovative partners and the inventions that our employees and stakeholders come up with.
Thanks, Rich. I really love that concept of run, run, jump, and testing and then scaling in the way that you're doing that. Sean, would love to hear your thoughts on sort of creating that culture of innovation and perhaps even touching on how you may work with a business partner, because the idea of automation and making jobs simpler sometimes jumps to the elimination of jobs, right? And so how do you manage those conversations and the culture around innovation when talking about Olive and the other solutions you have?
Sure. So internally, I mean, we talk about we have a few core values that I think are really centered around the culture and innovation and creating this daily decision kind of matrix. And so our first one is choosing vision over status quo. And we're always, you have a choice to make often. It's like you can choose the vision that we have created or share with our customers, or you can choose status quo. Choose the vision every time. Obsess about things like life depends on it, because it does. I mean, I think we oftentimes fail to remember that these mistakes cost lives, human lives, and this $1 trillion of waste could go to save a lot of human lives. I mean, this is a really consequential thing that we're doing, and we need to obsess about it as though lives depend on it, because they do. And then act with urgency is our third. And I think that it's incredibly important to operate in this kind of juxtaposition of both speed and patience constantly. Every day, micro speed, constantly moving fast and urgently, and then also being really, really patient over the course of a decade to make something that's meaningful. So partnering with our customers we've done it at an enterprise scale. So we're going in and saying, hey, this is not a one product that we're going to roll out inside finance. This is going to be an enterprise-wide initiative to create a new workforce. Now, the total workforce will be, X% human workers, X% AI workers, and together that workforce is going to be your new scalable workforce. And I think what we do is we kind of talk about that human job issue right up front, because it's a conversation that has to be had. And if it's not us having it, it's going to be another company. And I'd rather it be us, because I think we're just thinking about it in a more compassionate way, and in a way that is in phases. So the first is, right now we're going to add capacity to your system. Like you have capacity X, it's going to be X plus Y, because you're going to have more ability to process things, to take on new work, to catch up on all the stuff that has been sitting in the work queues forever. So that capacity increase is going to be really good. And then we're going to go through a phase where you can open up new service lines that weren't able to be opened before because of new margin profiles. And that's really exciting, because you can go to places you couldn't go before. You can do things you couldn't do before because it's not that human cost associated with it, which net leads to more human jobs. Similarly to how the ATM led to more teller jobs, not less, because the economics of the bank branch led to more bank branches. And I think that scale, like that growth that we're going to see in healthcare will actually lead to net new human jobs. And then likewise, one of our goals is not just to create AI workers, but it's also to create AI co-workers that are working side by side humans and turning, human workers into superhuman workers, increasing the ROI of your employees. So if your employee, if you're spending $57,000 a year on an employee and you're getting $57,000 worth of work, what if you could spend $57,000 and get $77,000 worth of work? And what tools do we build for these these frontline workers who are working in a life or death industry? What kind of tools can we build them to be more efficient, more capable, more productive, make less mistakes, care for people better? So that's how we approach it, and that's how we talk about it with our customers.
Yeah, that's great. And so one of the other things I wanted to talk about today, and you touched on a bit of how Olive helps make workers' lives better, right? And we saw during the pandemic that those people who are working in healthcare, regardless of where they are in healthcare, are exhausted. And it's not a new problem per se. It's just something that was highlighted throughout the pandemic. So can you, while we're talking with you, Sean, share a little bit more on how innovation can support the workforce? And then would love to get Frank's thoughts on this too.
So when I first came into healthcare a decade ago, I came from the defense industry. I was at NSA, and my job was to build software for war fighters who are on the front lines constantly. And it was a life or death type of industry. And the same applies for healthcare. The tech companies of healthcare have failed healthcare. We have not created the right products. We have not created the right technologies, the right software. So humans are routers between these systems that don't talk to each other. So they can't really focus on their primary job because they spend so much time routing information between systems that don't talk to each other, making up for where software has left off. If I were to say, who has disrupted shopping, the answer would be easy. It'd be Amazon. If I said who disrupted travel, it'd be, Airbnb or Uber or transportation, Uber or Lyft or Tesla. But if I said who has disrupted healthcare, it's crickets. There's not a company that comes to mind immediately. And that's because nobody has. And that's because we haven't put the time and the effort into it. I actually think that too many companies get sold too early. They raise some money and then they sell to somebody else, and they never make it to be like a big tech company who can spend real R&D dollars, like $1 billion R&D budget on solving these really tough tech problems. So we owe it to the workers. So how do we change their lives? We change their lives by truly investing in decades worth of technology, spending billions in R&D to solve tough problems, and not, getting to a certain point and deciding you're going to go away. Like that, you have to break through and build some massive tech companies. And to do that, we have to create real platforms, not like big software platform. I'm talking like a platform upon which new companies can be built. Thousands of companies, like the iPhone, or like some of these other platforms that have existed, where real companies can be built, billion-dollar companies can be built, thousands of them, because that's how we're going to create these tools for the people. And we just haven't gotten there yet, but we're going to.
I hope we do. Frank, do you have thoughts on how we can use innovation to help bolster our workforce and help them work better and feel better?
Yeah, it's a great question. There's multiple dimensions to this. Sean hit the technology side a lot, but there's the people dimension. How do you lift up these people? The three most disrupted components in our world today coming out post-COVID is really employee engagement, talent acquisition and growth, and health. And they're all really converged almost into the same thing. And so when you look at our workforce within health, what are the things that drive them? There's definitely a personal dimension, a human dimension. They like that human interaction. They like doing things to help somebody else, and really from a, help them be a better person and a healthier person. And technology absolutely has gotten in the way. So how do you get rid of the technology better to enable this more of this human dimension? And from a person, we've done some work with DHGE, excuse me, in terms of how you do this with nurses and engage with nurses, and really, what's the important thing there? One aspect, hey, do you care about me or not? Right? Are you helping me be a better nurse? And so can we augment technology? Can we help them with their skills and skills development? Can we help them want to stay where they are versus, getting so frustrated, I'm going to move, and all the things with that. So engaging with our workforce, both from a physical and mental health and a professional development, is really kind of key. And yes, we can use technology to enable that, and to provide that kind of engagement. But at the end of the day, it's really creating that sense of belonging that scratches a lot of the reasons people step into the space, which is well beyond just, hey, I just need a good paying job. There's higher level values and higher level motivations, and engaging with them at that level is extremely important, particularly coming off of COVID and driving into this more and more virtualization where I get less human touch. How can we make it more human and more human interaction? And I think that's the key. We got to just look at it from that mindset, that they're important and the people they serve are important. And it's not about the broader institution per se. And if we do that, we lift it up across the whole spectrum, the whole care continuum spectrum.
Yeah, that is really important, sort of as we come out of this virtual world during COVID, or in the healthcare space where the resilience has been really challenged for healthcare workers, and they're searching for that purpose and meaning and human connection within the day-to-day. Rich, would love to hear thoughts on workforce if you have them, but as we promised the audience, we want to cover a lot of topics. So also would love to hear your thoughts on how Common Spirit is using innovation to improve health equity.
Yeah, I mean, I think, at the end of the day, the important work that, is being done on workforce innovation really should be to take those things that are laborious tasks, unnecessary tasks, away from our caregivers, so that our caregivers can spend the time where it's most important, being the heart and hands of healing for patients when they're at their most vulnerable. And so I'm incredibly supportive of some of the work that Frank and Sean have been talking about, because those are the things that cause burnout, they cause frustration, ultimately they cause mistakes. And if they can be effectively automated so that, the human side of healthcare comes out in a deeper way, it's incredibly important. So, I think one of the, as we transition a bit to health equity, I think one of the fallacies in healthcare is this concept of standardization. And so there's a lot of push on standardization of, platforms, of processes, of clinical protocols, et cetera. And it somewhat misses the fact that people are individuals with individual choices, individual barriers. And so, ultimately, I think we need to do a much better job understanding people as humans, and the fact that, the medical side is but one side of, an entire ecosystem when a patient presents with a problem. I mean, really, a patient with diabetes is very different than a patient with diabetes and mental health disorders and, social support needs and a host of other things. And so much of our work on health equity is really understanding the supports that are needed by individuals, number one, and then number two is, who is best to provide those supports and those resources? I think in some ways, the healthcare world and the social services world are blending together into a similar type of ecosystem. And there's probably two ways it could go. Number one, healthcare organizations are really big. They're much bigger than Meals on Wheels. They're much bigger than FQHCs. They're much bigger than, small nonprofits focused on, selected vulnerable populations. And so we could probably medicalize, the social services sector in a way that, in my opinion, loses the value of the experts from these organizations that are really of community and understand people uniquely. I mean, I think we've seen this play out with vaccine hesitancy. Who do people trust, right? And so, I think our biggest opportunity and what we're trying to do at Common Spirit Health is really recognize those social services organizations as true experts in their field. Sure, we have medical directors, but this on the other side is the PhD of homelessness and understanding what's going on, or of housing, or of other types of things. And so, I think it's, how do we make it easy and how do we make it integrated for patients to have both social services addressed as well as their medical services addressed? That's one key component of health equity. And I think the other, again, relates to this personalization. And, we need people of community, we need staff of community, we need to be trained in ways to, understand intrinsic bias and other types of things. That means diverse teams and, really being able to check and to make sure that, these individuals are being treated in the most appropriate ways. And so I think a combination of this, really taking advantage of the community, being of the community, recognizing and elevating those voices and those advocacy groups that understand the community better than a technology company would, better than a healthcare system would, as well as, this personalization is really important. And the final thing I'd say on health equity is, it's the right thing to do for very rarely, I think, in the world, do you, as a business, do you do the right thing by society and also the right thing for your business and your stakeholders? This is absolutely one of those areas. Ultimately, I don't think health systems can succeed if they're not caring for people under value and under risk. And those are incredible sets of services under value you can provide to patients in these communities: transportation, food, other types of things that you can't do in a fee-for-service system. And so, I think the secret to success over time is health equity. In the closer and the more rapidly that organizations realize that, the more likely we'll have the right supports for our community.
Yeah, thanks, Rich. And I've seen a lot that Common Spirit is doing to sort of walk the walk on what you just shared. And so it's exciting to see all that work being done in the field. Sean and Frank, from your perspectives, how can innovation be used to improve health equity?
Well, I think that when we started Olive, we had this in mind. You look at technology today. When you're creating a website, for example, it used to cost $100,000. Now you can do it, for $5 or less for free, virtually. Innovation leads to access, and it makes things more equitable. I mean, platforms do that. Look at AWS. Look at any of the website building tools. Look at data. Data used to be very expensive. Now it's virtually free. And all these have created access to anyone. You can create a company in your garage, in your dorm room. You don't need to have servers and architectures and all these things that you used to have. I mean, and we say that and we take it for granted, but I mean, trillions of dollars of economic value have been built on that. It's changed everything. It's changed the way we shop, the way we eat, the way we travel, the way we go to everything. It's changed it all. And that's that real distribution and access. And it'll do the same thing, I think, in healthcare. The small hospitals in the rural towns around America are literally the #1 employers. And they don't have the same technology that the big systems have. That is absolutely the case. But they should. And they should have it because the technology gets commoditized to a point where everyone has access to it. You should be able to get, the most sophisticated automation, the most sophisticated AI at the hospital in Southeastern Ohio, where I grew up, that employs the most people. And I think it's the only way to do that is by building platforms. And I'm keep going back to that because I know it's a tech, it sounds like this, tech utopia, but it is what has changed every single industry that we know today. And unless we have a true platform in healthcare, we won't see that equity. And it's super important. Access, right now, most people on Medicaid have access to supercomputers in their pockets. Like, that is incredible access. That didn't exist, before it became a platform. And I think it's truly the ability to build billion-dollar companies on top of something inside healthcare that will change it.
Yeah.
Thank you.
Yeah, I love this topic, actually, because it's one of the reasons we exist. And so when you take a step back, we felt there's this really amazing convergence happening, and really going to create these moments in time that allow us to really fundamentally change everything. And that conversion, we talk a lot about technology, but when you think about it from the technology evolution perspective and Moore's law applying to healthcare, we have the power of an ultrasound, for a couple $100 that can be put in a bag, a doctor's bag for a home visit now. And all these emergence of these edge diagnostic machines around, how we're built, how we're functioning, kind of these immediate responses that doesn't require us to go to lab for blood draws. I mean, I just think that's an incredible kind of push over to the edge to kind of change that whole engagement model. And then when you start adding in, again, we're in a data abundance versus data scarcity in terms of understanding, and the whole aspect of connectivity. The world itself is at a tipping point. I mean, roughly, over half the people in the world have smartphones. It's a lot higher in the United States, but we're talking worldwide. Add another 30% that have feature-rich phones, so it's this mobile first. But yet they're in places where they don't have access to healthcare professionals. So that extends access out. The ability to bring kind of diagnostics to them versus having them go somewhere, it extends kind of these intelligent engagements with health professionals. And not to mention, then you start tapping into this whole new wave of innovation. People that aren't in, San Francisco or the Bay Area, in the middle of Nigeria, that's throwing up this whole new method to get people access to healthcare. I think that happens. One of the reasons we like blockchain, not from a technology perspective, it works, it adds things, it adds a different dimension, to how to solve problems. But when you look at what it's about, an approach to doing things, this is what we liked a lot about it, because blockchains themselves are networks. They can be a platform, but it's a platform with a shared incentive model. And in turn, they create connections, and connections are what create communities, like-minded are people that can converge in a community like this public-private partnership that came together for vaccine creation, or long-term care communities that have the same condition. And it's communities that end up driving markets that, in my mind, even facilitate compassion, because people I believe in, deep down in their heart are truly compassionate and will respond if asked. So that whole notion of kind of building this platform out, I 100% agree with the concept of building that platform and extending access to that platform to brains and minds that traditionally didn't have access to kind of capabilities required, but definitely have the skills to drive kind of this different innovation and engagement models. So love that approach.
Yeah, I love what all of you are sharing. And I do think that innovation has this tremendous ability to create access, and the technology can sort of eliminate the digital divide that we hear about when we talk about healthcare generally. But there are still some people who may not have access to broadband across our country, that if they have access, they may not be able to afford it, which basically means they don't have access. There are people who, we can give them an app or a digital solution and they can't read it, they can't understand it, they can't engage with it. So, we've been talking a lot about health equity, but there's also this concept of digital health equity, right? So how do we ensure that individuals can actually access and understand solutions that we put in front of them? So if we create this mega platform that can do all of this, how do we make sure it is truly working for everyone? And Rich, maybe I can turn to you, because I do know that Common Spirit looks at this idea of digital health equity when you're evaluating tools like Docent Health and others. So maybe you could share a little bit about how you do that and think about it.
Yeah, that's a great example of one where, I think sometimes, when we talk about innovation and we talk about, the future and a whole host of other things, people are imagining that there's this, secret technology that's going to come and solve everyone's problems. And, what what we find out often is, again, like how do people interact day to day? Well, they interact with text, right? It's real simple. Like, and so pretty much everybody texts, regardless of demographic, in a really strong way. And text is really meaningful. And so, one example of something that we've done recently is really two things. One is, again, I'll come back to, it's really important to have people of community on your team that understand the human nature of care, not just the medical nature of the care, because the medical nature of care is very complex. I mean, people go to school for long periods of time, physicians for decades, right, to understand all of this medical terminology. But, if you take something like the pregnancy journey as one example, and, you have someone of community really develop a relationship that can be a bridge between, the traditional, every day of your life and the medical world, and help you interpret and understand some of these questions and text with them along the way, you can have great outcomes clinically. And so, it's simple as things as, hey, I was thinking of asking the physician this question, but I'm afraid I'll feel dumb if I do. And then, your coach or someone that's working with you can say, I know, absolutely, you have to ask that question. That's not a dumb question. It's a really important question. And if you need ways to frame it, we can help you think about it, but definitely ask that question. But things like that, we've been, texting alongside mothers and the pregnancy journey. And we found that if we do that, statistically significantly more likely to carry their babies to term, statistically significantly less length of stay in the NICU, et cetera, amongst diverse populations. We actually did this study recently, primarily in a Latinx population. We're going to be repeating it, working with some large foundations in African-American population. There's obviously some very tragic outcomes there as it relates to the maternity journey. But ultimately, I do believe there are simple things that can work and get this done. And sometimes we forget about simplicity and go to something, much more visionary and complex. But ultimately, if we understand like why healthcare should fit into the way that you normally react in the rest of your life, it shouldn't be a separate system, a separate app, a separate login, something that, you're going to forget. It should just be like you're accessing the regular other things in your life. And I think if we take a step back and say, why isn't it just that easy? And you find these simple solutions, they can really benefit the community served.
That's great. And I saw Sean and Frank's head nodding as you were talking. So Frank, maybe I can turn to you and then I'll ask Sean to comment on this concept of digital health equity.
Yeah, it goes back to that relationship model, right? Can we help us really connect better as a community, in an everyday, all the time thing? Because health is an everyday, all the time thing. It's not just when I'm sick. My life journey has my health journey as part of it. And so if we can kind of intercept some chronic conditions earlier and keep people a little healthier, I know that's really the ultimate objective that we're all talking about. And when we talk about that human dimension, that coach, that person interaction, that's so important to keep people on track. And technology allows us to do that, because what's happening on just say the health and wellness side of life. How many new diet type companies? It's not just really diet, they're lifestyle companies that provide a coach for you all the time. And sometimes that coach is a real person, and sometimes that coach is a little mini AI or conversational kind of chatbot that lets you know they're still there. Get a motivational quote at a certain time of day. It makes me feel like I belong to something, and that's really all part of health. That health equity. Do I belong? Do you care about me? Are you going to lift me up as a person in some way and help me feel healthier? Tech reduces the cost to that outreach and that connectivity in that everyday, all the time thing. That's what tech does. It doesn't replace the person, though. It doesn't replace that interaction. It augments it. And I think when we kind of keep that in perspective and get kind of on the healthcare workforce side of life, used to that augmentation, and maybe even having a digital version of myself that's really has my personality that can interact. People on the other end are already used to this. I mean, how many times do we say, Alexa or hey Google or help me do this. We're not interacting with the person there, but we're really comfortable with it. And that comfort level and that ease of use and that extension out, coupled with lifting up and helping people be not only more effective in their job, but being able to have the time to be more human in their job. I think that's where it's all going to boil down to. Let's just reach those communities that we just can't reach to yet.
Thanks, Frank. And Sean, when we were prepping last week, you gave a really great example of a blood pressure cuff that could become a Wi-Fi hotspot. So maybe you could share a little bit of that as well.
Yeah, sure. And so this general topic is something I spend a lot of time thinking about. Specifically these parts of critical infrastructure that are now part of health, and those things are like electricity and shelter and logistic systems for food and getting access to groceries and communications. These are all basic things that are part of health. So these new infrastructures need to be either created or built or thought about. So I've been thinking through like ways to provide access to the internet in the case of like the pandemic, when that was the only way to receive health, basically.
Mm-hmm.
And one of the ways that we're thinking through that is building a micro network of devices out there that are DME, like the durable medical equipment style devices, blood pressure cuffs, glucometers, sleep apnea machines, CPAPs, all those kind of things that actually have hotspots in them that can be activated at any certain time. Activate a kind of micro network that's all tied to a mobile virtual network operator, an MVNO that goes through cellular. So that's like that is one of our initiatives underway right now, is experimentation and creating these micro networks where we can turn devices into mini towers of digital access. But there's others that I think need to be done. And we have to remember that we're dealing with multi-billion-dollar organizations and a multi-trillion-dollar industry. If we need to build a new internet, we're going to build a new internet. If we need to build a mobile virtual network operator among all the cell towers so that people can have access to SMS or the internet, then we're going to build that because it's worth it. And we have to be thinking about building this new infrastructure. It's something I spend a lot of time thinking about. What is the emergency, always on access to health that we build in this country? What does that infrastructure look like? And then how do we give access to people who really need it, and make sure that we never kind of go blind on those individuals. I think there's some really promising new technologies that have been accelerated through COVID. The pandemic has made it very obvious that communications is a piece of health infrastructure.
Yep, absolutely. We've seen that loud and clear through the pandemic, along with a number of other things. So I'll turn to some of the questions that we've gotten from the audience so far. We have about 9 minutes left in our conversation. If others in the audience have questions, please feel free to either put them in the Q&A or the chat. But the first one I want to get to is, of course, people want to maintain privacy in healthcare. So how do we innovate, recognizing that in emergent situations, people want to maintain their privacy, so they shy away from participating in digital options to healthcare. So I guess the question is really, how do we innovate and move forward, acknowledging that some people want to maintain their privacy? Are there ways or solutions that we can still reach those individuals?
So this is Rich. I'll dive in there. I think obviously, we're one of those multi-billion-dollar organizations Sean talked about, and we've been in communities for a long period of time, over a century in many areas. So we think we have to earn and keep trust relative to privacy. Privacy is really important in healthcare. I think the flip side of that is, when you look at HIPAA and other things, I think organizations often use that as an excuse to not do things. And the reality is, if an efficient exchange is presented, we need to have this piece of data. And if we can have this piece of data, we can better customize your care to ensure that your history's reflected better, or to ensure that a pathway of care is more customized and personalized to you. People are willing to sign those HIPAA forms and give over that data if they see an effective exchange that betters their lifestyle and is worth it to them. And we've seen that time and time again. So absolutely, we need to safeguard privacy for those individuals that really want to maintain the sanctity of their data. But there are others that are very willing to sign over pieces of data to get other pieces of value that are really important to them. And to me, that's the heart of what HIPAA is about. It gives the patient the choice relative to what they want to share, how much they want to share, and everyone makes different choices because we're a very diverse country. And so I think both things can be achieved, but the patient is really part of that equation, and they should be given the choice.
Yeah. Frank, I saw you were going to jump into that question.
That's awesome. Because it's one of our fundamental principles that people should be able to maintain their privacy. Consent is at the heart of that. A lot of people in the HIPAA forms, some understand it and some don't. They sign it because it's part of the process. And as Rich was saying, it could be an inhibitor to collaboration on the back end and the caregivers. So we think that consent is probably one of the tough problems to solve in this whole digital outreach, and making it transparent. You see a lot of laws emergent around GDPR in Europe and similar kind of privacy laws. We just passed a whole bunch of new ones in Colorado in terms of protecting individual privacies. And it's one of the reasons kind of we started what we did, is I got tired of people taking my data and stealing it and using it for bad things. But that consent and giving people that aspect of they're empowered. Like, if I don't want that doctor to have my stuff anymore, yeah, I know they have to maintain it for so long regulatory wise, but I'm gonna pull it back, right? I'm gonna own that consent. And yes, and I think what you're gonna find is that as it flows through into the broader public health side and even research, a lot of people are gonna opt into doing that for just the betterment, or even different kind of incentive models to do that. So consent is a big thing to solve as we kind of push out, in Sean's vision, we push out this internet of healthcare. How do you engage at that level and let people have that kind of transparency that they know where their data is, what's happening with their data, and if they don't want it used in a certain way, to have the right and the ability to pull it back.
Yeah, absolutely. And in the interest of time, I'm going to jump to the next question so we can get through as many as possible. But this next question, Rich, you touched a little bit on it in terms of using HIPAA as an excuse to sort of not expand these technologies. But the question is, do you find that the corporate shared services, so HR, legal, IT, sometimes can create artificial barriers to innovation? And how do you address legal conservatism, IT approval processes, and other things to not destroy the ability to innovate quickly? And Rich, I think we can hear about this from the provider perspective, but then also get Sean's thoughts as he goes in to sort of offer these solutions within healthcare providers.
Absolutely. And this goes to the heart of the point I made earlier on our run and jump process. There are no fast passes. If you want to do something at scale, you're going to have to engage your legal team, your security team, your privacy team, in some cases your HR team, depending on what the issue is. And so you have to work through the barriers. You have to build those bridges with those teams to make sure that the safeguards are there, the connectivity is there. Now, there definitely can be pathways to prove, if we do these 3 things, are we good to get to the next level or what have you. But, I think so much of the challenge in, healthcare innovation is creating false realities where things can be done outside those teams. And then when you actually want to scale something, you're starting from ground zero. In fact, you're below ground zero because you went around those teams ostensibly. And so I think the key is figuring out the champions on that team that really want to create positive change, and working with them towards a structure that makes sense to really scale these opportunities.
That's great. And Sean, I'll pass it to you.
So this is another one of those things that when I came into healthcare, everybody told me, that everybody in healthcare was slow and that nobody wanted to innovate. And I just don't buy it. I don't think it's true. Every single health system we've worked with, they are super motivated. They want new technologies. They are incredibly easy to work with. They are, I mean, yes, you have to do the work. You have to go through the security. You have to do the stuff. But guess what? It's way better than any other industry I've seen, honestly. And I think we have to change the narrative, because people get embroiled in these narratives and we look for the exception to the rules. We look for the path that Rich was talking about. We look for some kind of like hack to the system. The system works really well. You just have to put in the work. Health systems are ready to go. They're forward leaning. They're motivated. They have great procurement processes. They have great, technology implementation guidelines to follow. HIPAA is a roadmap to success. You just got to follow it. I mean, everything is laid out for you. You just have to do the work. And I think it's incredible. I think health systems are in a good position to adopt new technology, and it's been proven. I mean, we are able to go at lightning speeds. I mean, faster than the sales cycles of many industries, because everybody knows that it's life or death, and they're willing to do whatever it takes to get the technology in to care for people. And I've seen zero exceptions to that. I've seen it across the board. Not one health system we've gone to where I'm like, it's their fault, not ours. It's always our fault if we're going too slow. It's never the health system's fault.
That's really good to hear. And it looks like we are out of time in today's discussion. Thank you, Sean, Rich, and Frank, for being with us today and providing all of these amazing insights on innovation and how you are working to change the way we deliver healthcare in our country. So many great examples were given today. And I'm hopeful that the audience took something away. Thank you all for listening. And now I'll hand it back to Felicity for an exciting announcement and some closing remarks.
Hi, I don't know how to summarize that amazing discussion. I would say that, Rich, I hope you don't mind if I adapt your run, jump to hop, skip, jump in a nod to the Olympics. I think still, you could do that. I think it's amazing that all the discussion around platforms, it's something that at DHGE, we're really trying to build as well, because, as you discussed, Frank, that employee engagement, talent retention is something that obviously we have objectives around through providing high quality education where people shouldn't have to compromise, cost for quality. Patricia, would you mind just sharing, perfect, that slide. So we discussed health equity. I'm mindful of everyone's time, so I'm going to wrap it up really quickly. We obviously touched on health equity. I'm delighted to announce that we also believe that equity in education leads partly to health equity, and we've partnered with Common Spirit Health to secure a $3 million scholarship pot, where we will be offering over 1,000 scholarships to healthcare professionals across the US. And I invite you to just go to that URL, have a look. We've got programs from various university partners. So please take a look at that. And yeah, thank you everyone for joining. I saw we had people internationally. So good morning, good afternoon, good night. And yes, thank you everyone so much for attending and speaking. Have a great day.
Thank you.